I remember when my dad let me drive his old beat-up truck to high school. I could feel people looking at me when I pulled into the parking lot, sounding like I was dragging empty tin cans behind me, and then parking it next to a classmate's BMW. It was the first time that I realized not every family had the same amount of money, and that people make assumptions about income depending on where you live or what you drive. There were many families like mine living in St. Albert and Sturgeon with little disposable income. After high school, I went into an LPN program, and I not only enjoyed it, but was good at it. Over the next 10 years, I had many different experiences, from acute care and neurosurgery to home care and dialysis. I followed my passion to Vancouver and was excited to return to my hometown a few years later. After being a nurse that cared for others, it was a shock to suddenly become a patient needing a lot of support from the system. In 2017, my son was born 2 months early, weighing only 2.5 pounds. My husband and I spent 2 months at our son's bedside in the NICU, neither of us able to work. Less than a year later, we were separated, and I was raising our son alone. In the early days, I had to make hard choices: diapers, food, or gas. On a few occasions, I had to put food back at the till. Holidays and birthdays were stressful, wanting to still provide a great experience, but worrying about the financial toll. I was often scrambling for childcare so I could get to work and pay the bills. It was humbling living paycheck to paycheck, and it made me appreciate my family and the supports I did have. I was lucky in that sense. I always had a great support system, and it got me through the long, dark days. It took time, but I have adapted, and my son is healthy and thriving. Still, every day, I meet people in my work as a primary care nurse and health educator that do not have the same supports I did. I know how small things can compound and negatively influence your health. I have often met with people struggling to leave an abusive situation, knowing that it would worsen the financial strain they were facing. I have also seen patients wanting to improve their health, but not being able to eat fresh vegetables or fill a prescription simply because they need to pay rent. Through my role on the RIFS team, I am proud to be an advocate and work with community partners to improve access to services. Working together, we ensure our community is a strong support system for those that may not have one.